Okay. I am gonna go ahead and just get started. If someone else wants to join, I'll make sure they get credit.
Okay.
So, sorry, I got a big box here. Um, so I'll just kind of go through this, and if you guys have any questions, let me know. I mean, you guys can just ask, or you guys can put them in the chat, either way. But if you don't and you just want to be on mute, that's fine too. I don't have any
Okay.
problems with that. We'll just get through the information. Um, if you need to step away for a quick minute, that's fine too. If you guys need to eat or whatever, also totally fine. I know,
Okay.
I know you guys are probably very busy. So, um, I'm Jennifer. Who are you guys licensed with?
TFI.
Okay, TFI. Yeah, I'm Jennifer Danford. I'm actually with KBC. I'm the foster parent trainer. Um, I've been, excuse me, doing training with them since January of this year, but I have a lot of experience in the child welfare system on the Missouri side, and then also with community mental health with kids too. So that's kind of the background I come from. I do this training because our kids are pretty vulnerable, our teens especially, and so they often kind of get caught up in things like substance abuse, and so it's kind of helpful for our foster parents who are dealing with that in our kids. So hopefully your teen isn't going to be dealing with that, but I'll give you some information. So if you ever have to deal with that, you'll be kind of armed with some information. So I'm just going to go through this. Again, if you have any questions, let me know. I'm glad to answer those, but we'll kind of just get through a lot of information here, and hopefully some of it will be helpful. Um, in this training, we kind of want to talk about what the substances are that are being abused. There's a lot of terms, obviously, slang that kids come up with that is constantly changing. So, talk about that. We'll talk about what it looks like when someone's using substances and how to recognize some of those symptoms of abuse. And then most of the time, foster parents are mostly interested in some interventions. So we'll get to that too. So this is kind of an organized presentation by substance, but in the beginning, I just wanted to give you guys some idea of prevalence and what happens nationwide and even in Kansas. So this is some alcohol prevalence, but 25% of high school seniors have tried alcohol. Um, Almost 30% of high schoolers in general, so all grades, drank in the last month. 14% are binge drinking, so consuming, massive amounts of alcohol in a row. And then alarming also that 17% have rode in the car of someone who's been drinking, and then 5% are driving after drinking. On a lot of these slides, I'll put the references on the bottom, but at the end as well, I can, it will list the references. So reasons our kids are trying substances haven't really changed over time. Boredom, their peers are doing them. They have anxiety or social anxiety. They want to try new things. There are some substances that help them with concentration, to lose weight. They might have poor impulse control. That's where a lot of our foster kids are at, to escape some um, hard things, and then to self medicate some of those undiagnosed or untreated mental health things. So, just a slide to kind of show what that looks like. So, this slide's a little fuzzy, but I included it because it's specific to Kansas, and I like our foster parents to know what's going on in our state. This is showing alcohol, cigarettes, marijuana, prescription, and vaping, but it's showing um, use of at least once, um, percentage wise. So It looks like we are kind of trending downwards. The highest is alcohol in the blue. The second highest is vaping. So that's kind of where we're at right now in Kansas. And you can get a lot of information from this website I have at the bottom. Um, so this is interesting. This is how our kids are perceiving the risk of harm per um, substance. And so they do perceive that marijuana is harmful, which is good because I'll talk about later how that is harmful. But the rest of them, not so much. Vaping is really kind of sitting around 8%, 9%. Alcohol is pretty low overall. And there is a large amount of harm that can do. So interesting to get some of these surveys back and kind of look at that. There are some risk factors that increase our kids' vulnerability for substance use and abuse. Some of those things are if they have family history, which a lot of our kids do. If the home they're living in, the caregivers have favorable attitudes towards using. If they aren't being monitored very well, if their parents are using, if things are happening like rejection of sexual orientation or gender identity, those kids have a lot more substance abuse association with people who are using. If they're not connected to their community or school, and it's been associated with low academic achievement as well as some traumas like sexual abuse and mental health issues. So it's really tricky when it comes to signs of anything because signs of trauma can look like signs of substance abuse, they can all kind of tie together. So really, you kind of have to be a detective if you think someone's using and then you start seeing these signs. That's when you might put two and two together. But if their behavior changes for no apparent reason, like significantly, um, they might be, you might see depression or they might become overly hostile. Um, they change their peer group completely. You see that they don't care about how they look. Their academic performance takes a complete dive. They're not going to school. They lose interest in activities that they cared about, like maybe sports or band or something like that. They're eating or sleeping differently. And they have declining relationships with people they cared about before. So those things can be kind of indicators. So yeah, here's another chart I got from one of those sites as well, but they want more privacy, obviously. Maybe money's disappearing. They're losing weight or gaining weight, or just some different ones. But there can be protective factors too, that can kind of shield our kids or make them less likely to use. Parent or family engagement, if they have a lot of support. Um, Even having some of that disapproval of substance use, parental monitoring, being connected to either school or community, church, just having some sort of um, support. It can be very helpful. I would say also, I'll talk about it later, but having access to reliable information when it comes to these substances. So this is what can happen when our kids use substances in terms of high risk behaviors. So 15% of our high school students have used some of these illicit drugs, which are harder drugs, cocaine, inhalants, heroin, methamphetamines, hallucinogens, or ecstasy, which is a large amount. 14% of students report misusing prescription meds. So here we get into some of these higher risk behaviors. So when they use these prescription opioids, that is actually directly linked to sexual high risk behaviors. So, students who use these prescription meds are more likely to be a victim of physical or sexual dating violence. So, putting themselves in situations where those things might happen. Um, and then this drug use is associated with sexual risk behavior, violence, mental health, and even suicide risk. There's a lot of studies that show that. So, some of those high risk behaviors are things we definitely want to avoid. I will kind of go through each drug, like I said, but there are some consequences that are just kind of overall that are alarming and we need to kind of watch out for. Um, we do get kids who have drug dependence, who actually have substance abuse disorder, and it's hard to find services sometimes for these kids. So that's a huge consequence. Um, our kids have impulse control issues. I mean, kids who don't even have trauma do. And then add trauma, and then add substance, abuse, and then we're looking at really poor judgment, and that can lead to some pretty bad things. Um, Drug use is associated, I just talked about it, with sexual activity, which can be high risk even. Um, we're dealing with kids with trauma, we know that, and then we add substance abuse, and that can lead to mental health disorders. It can increase the risk of some of these disorders, or exacerbate some of the symptoms, like depression or anxiety. And then impaired driving. We definitely don't want our kids driving under the influence. And then it can affect their schooling, which is something that can affect life in general. Some of the health effects that we have to watch out for are cocaine. We don't have a lot of cocaine use, but if our kids are doing that, they can have a heart attack right away, stroke or seizures. Ecstasy can lead to liver failure, heart failure, inhalants. Inhalants are pretty serious, and we do have kids that do that because they're easy to find. A lot of foster parents don't know what kind of things kids are using, and I'll talk about that, but that can damage the heart, lungs, liver, and kidneys. It can be pretty significant, um, even after one-time use. And then I will talk about marijuana a little bit because I think with legalization and things like that, we've kind of looked over the fact that it's a pretty dangerous drug for teenagers. It does give them a lot of side effects that can be lifelong, just because their brains are not developed. So meth is just a terrible drug overall, but it can really mess with their brains long term. Opioids, we still do see a lot of this with kids. It's harder to get prescription medications. Luckily, doctors don't typically hand them out like they used to, but kids still do use these, and they can die from an overdose pretty easily. And then vaping, our kids do vape. It's still a thing. And vaping is dangerous. I'll talk about that, but one thing that we don't always think about is that kids that come into our homes can be addicted to vaping, which can lead to withdrawals. Just like if a adult was had quit smoking, which is pretty significant. So we will kind of talk about that. So kind of getting into the drugs, I'm kind of going to go through some of them and just give you some facts and things like that. But alcohol's the first one because I think our kids typically kind of start with that one, and it's pretty easy probably for them to access that. I know in your guys' homes, you guys probably do a really good job of keeping that away from them, but they can always go to friends' homes, or there's always that kid at school or whatever. And so our kids sometimes can find a way. Um, so there's this relationship between having um, adults around who binge drink. And that relationship leads to a higher risk for kids who are in that community to be alcoholics or have alcohol problems later. Um, there's some percentages that go with that, but if kids see that and are around it, it's a higher risk, essentially. Um, More adolescents use alcohol than really any other drug or substance. Um, Almost 15%, 14% in ages 16 to 17, um, which is unlikely that they're using it appropriately, or I mean it's illegal and they're underage, but if you even think about the safety factors that go into that, it's pretty scary to think about. So underage drinking, it does cause a lot of deaths, but a lot of them can be accidental deaths from auto accidents, um, homicides, getting a hold of guns and just having accidents. There's even, you can overdose from alcohol, falls, drownings. There's a lot of drownings and suicides. So there's a risk from that. It causes a lot of injuries, which can be lifelong situations and scary. So it says almost 200,000 people younger than 21 um, visited an emergency room for alcohol related injuries. It impairs judgment, which we already know. Um, then they make poor decisions that could be decisions that stay with them. And then it increases that risk for physical or sexual assault, which would just be another trauma for them, which would, put them at risk for using other substances. It's increased with being the victim or the perpetrator of interpersonal violence. So it can lead to other problems. The kids can have trouble in school, or get in trouble with the law. And then we know that it's associated with the use of other substances because they are impaired. They're less likely to make good decisions, and so they may make decisions that they wouldn't have made otherwise. We also know that it's tied to having alcohol problems later in life. So if you start drinking before the age of 15, you are at a higher risk for having an alcohol use disorder. Um, if you So adults who are 26 and older who began drinking before 15 are 3.5 times more likely to have an alcohol problem. So than people who waited till the legal age. So we want to avoid that if all possible. It interferes with our brain development, which a lot of these substances do. We know our brains don't actually stop developing until way into our 20s. And so using any of these substances can really affect some of those growth patterns. Um, there are a lot of risks, like I was talking about, alcohol poisoning, um, car accidents, dependence. So just have to be careful about that. There is also kind of a thing where our kids have been, and adults too, into alcohol and caffeine mixed together. And so I think they've kind of pulled back on what's available. A lot of the drinks have been pulled from the market, but that doesn't mean people aren't mixing still drinks. They used to sell drinks that were pre-mixed, but usually they'll mix caffeine with alcohol. So the problem with this is that it actually leads to, typically, there's some statistics here, um, them to drink more because they don't feel as drunk because of the caffeine. Um, so drinkers between the ages of 15 and 23 who mix alcohol with those energy drinks are 4 times more likely to binge drink. Um, so it's a kind of a false sense of security in terms of if they're feeling drunk or not. So that can be super dangerous as well. So something to watch out for. So yeah, we know alcohol's not good. Marijuana is probably, besides vaping, it's probably the next one. Um, our kids do use marijuana. Here's some statistics on kind of what's going on with our kids. 8.33% of 12 to 17-year-olds report using drugs, and then of that, 83% are saying that they are using marijuana. So, um, when kids are using marijuana, there is a percentage that uses marijuana every day. Um, they have poor outcomes in terms of school, and we do have research that shows that it harms our brain if we are still developing our brain and we're using marijuana. So it can actually harm brain health. So it can impair thinking, memory, and learning, which are things that we really need when we're teenagers. So one of the big ones is the mental health issues. Um, Through studies, it's been shown that marijuana use is linked to depression and social anxiety in adults, but that can be exacerbated if they are using as teenagers. People that use marijuana in their youth are more likely to develop some of the things like psychosis, long-lasting mental disorders, including schizophrenia. And so we really need to. It's hard to tell kids, no, you can never use marijuana, but one of the strategies is to push it off, push it off. Say, you don't want to make that decision right now. I'd like you to wait until you're, an adult to make decisions like that. It's also dangerous when you drive, even though, the kids will say it's not. And then there is a potential for a marijuana use disorder, which is kind of like dependence, even though people will say you cannot get addicted to it. But a lot of people who do smoke will start smoking it daily, and it'll be very difficult for them to stop because they will have increased symptoms of anxiety or depression when they lower that. So I do have a quick video here because he really kind of gets to the point of why it's not good for kids to be using. Um, so I'll just play that.
Cannabis is a unique instance in which nowadays we are hearing, yes, it's becoming legal in a number of areas, and we talked earlier about why that's probably a good thing in most circumstances, but that we aren't just hearing that cannabis is safe, or it's not just being implied that cannabis is safer, but many more people are talking about the positive effects of cannabis without a lot of discussion about the negative effects of cannabis. And I realize that saying this is going to upset some people out there because I know that there are a number of people who fought very hard for the legalization process, and I want to acknowledge that. I also want to acknowledge the many known positive effects of cannabis in adults with very occasional use, provided it is delivered safely and in the safe context and setting and with legality. That is entirely distinct from the issue of whether or not cannabis is safe for the developing brain and body. Again, I'm not demonizing anybody for using cannabis, but I want to make the point very simply and very directly. It is far and away a different circumstance for the brain for an individual to be 25 years or older and using cannabis in whatever form occasionally, or maybe even frequently, than it is for a young person aged 14 to 25 to be using cannabis either by smoking or vaping or by edible or any other form on the brain and body. It's absolutely clear that the brain continues to develop at least until age 25, and that a huge number of systems related to mood regulation, so-called executive function, the ability to organize one's thoughts, plan, and execute plans, essentially to become a functional human being, right? That's one portion of becoming a functional human being, but certainly an essential one. All of that relies on the fine-tuning of this neural circuitry that we've been talking about up until now. And it's abundantly clear that cannabis and THC in particular dramatically disrupt those processes. So if this isn't clear enough just from my statements, I'd like to point to a particular paper. This is one of the more impactful papers in this area in recent years. This is a paper published in Lancet Psychiatry in 2022. Title is Association of Cannabis Potency with Mental Ill Health and Addiction, a Systematic Review. There are a number of very important points in this very fine paper. Lancet Psychiatry is one of the premier medical journals out there. And they evaluated a huge number of studies. They actually looked at more than 4,000 studies. They selected the ones that were only the most rigorous in terms of study design and analysis and rigor of conclusions. And they looked at how early use of cannabis impacted later probability of development of psychosis and other psychiatric conditions. And the takeaways from this study are very clear. First of all, chronic cannabis use, so more than twice per week, has consistently been associated with mental health disorders. I'm pulling some phrases directly from the paper. Heavy cannabis use, meaning cannabis use more frequent than twice per week, has been associated with 4 times the risk of psychosis later in life, in particular, schizophrenia and bipolar-like episodes. Now, we've done an episode on bipolar disorder, so-called bipolar depression. We have not yet done one on schizophrenia, but both bipolar disorder and schizophrenia have a very, very strong genetic component. There's a 30 times greater likelihood that you'll have bipolar disorder if you have a first relative who has bipolar disorder. And then it's also the case that using cannabis, especially during adolescence and the teen years and up until age 25, create a 4 times greater risk of psychosis for those that have a predisposition to bipolar disorder and or schizophrenia. Now, I don't hear very much about this in the media. This paper got some attention and then it sort of got swept away. I don't think that was an intentional sweeping away. There's just a lot of events in the world, as you well know. But I think it's a particularly important set of findings because obviously in looking at so many studies, it distills out the strongest findings that are out there and really pulls the consistent messages that are arriving from all these different studies. And as they point out, and again, I'm paraphrasing here, this is the first systematic review of the association of cannabis potency. And all of the data point to a very clear conclusion, which is the more potent the THC concentration, the higher probability of developing psychosis or a major depressive episode or a major anxiety disorder later in life. That should be of particular concern because we are absolutely clear about the fact that with the advent of all these new strains of cannabis and with the engineering and availability of cannabis at much higher potency, meaning THC potency, the risk of psychosis is going up and is likely to continue going up unless something is done to reduce the frequency of cannabis use to 0, ideally, or to very low frequency, very low potency in adolescents and teens and people aged 25 or younger. I know a lot of people don't want to hear this message because, first of all, it's alarming. And second of all, as I mentioned earlier, the statistics tell us that the greatest number of people that are starting to use cannabis are in the age bracket of 16 to 24. Many of them are functional in other areas of life. They are students, they are employed, etc. But when you couple that with the fact that the most frequent adopters of cannabis use are in this age bracket of 16 to 24, they're twice as likely to use as other individuals or to start using cannabis as are other individuals, plus the general perception out there because of the way that cannabis is discussed in the media and by sports figures and by celebrities and by politicians, etc., that it's not as bad as alcohol and maybe not that bad and maybe even has health benefits, then you're essentially setting up a system where young people are far more likely to adopt and continue cannabis use without realizing these serious health consequences that await them later.
Yeah, so I thought that video was very informative. And I think the points he made are really good because I do think our teens enter into that use without knowing kind of what's dangerous about it. So I want to talk about vaping because I know We do have a lot of kids who vape or smoke, but I think vaping's pretty popular. Really, it's e-cigarettes. They're known by a lot of different names. E-cigs, my electricity. E-hookahs, mods, vape pens, vapes, tank systems, and electronic nicotine delivery systems. I think vapes is really what the kids call them. So they heat the liquid and produce an aerosol or mix of small particles in the air. They come in a lot of shapes and sizes. I have a picture coming up. Some of them look like regular cigarettes, but a lot of them look like flash drives, pens, other devices. Kids can even hide them in their sleeves at school. Here's kind of the gamut of what they might look like. So you could easily have something like one that looks like a pen or something at school and probably be pretty sneaky about that. So usually the liquid has flavorings in it, but it almost always contains nicotine. And so they inhale that vape vapor, and they also, it can, if you're standing around them, you can breathe in that aerosol when they exhale it into the air. You can also put marijuana into vapes. So our youth are doing that as well. You can buy ways to do that, or they can work out ways to do that. So almost all of them do contain nicotine. So 99%, a CDC study found that 99% had nicotine in them. Some vape labels do not disclose that they actually contain nicotine, and some that are marketed as containing 0% nicotine have been found to contain nicotine. Nicotine can harm the developing brain. It can harm the brain, the parts of the brain that control attention, learning, mood, and impulse control. So one thing about vapes that's really interesting is that they were kind of invented to, what they said was to help people stop smoking. But one of the poor things about that, the thing that they didn't think about is, or that they did, I don't know, is that when you smoke a cigarette, you go outside, you smoke one, you put it out. But there's no putting it out with the vapes. So there's, what has happened is that people actually smoke a lot more nicotine when they're using vapes because there's no ritual where you put it out or you only take 3 smoke breaks a day. And so what's happening is our teens are actually taking in a lot of nicotine. So they can become dependent, and then when they get caught, or we take it away, or we send them to a different placement, they go into withdrawal, which they maybe know or they don't know. They may not be aware that that's happening. And it looks just like when adults are going into nicotine withdrawal: irritable, restless, they struggle sleeping, can't concentrate, and they crave that nicotine. They may want to use vaping to deal with stress or anxiety, but that just creates this cycle. And it can be a source of stress, especially for a teen who's trying to hide it and find ways to pay for it, and those things can turn into an addiction. And then the most common reason that our kids in middle school and high school in the US give for trying them is that a friend was using. The most common reason they give for the continuing use of them is that I'm feeling anxious, stressed, or depressed. And e-cigarette and cigarette use have been associated with mental health things like depression. So real quick, what's in vapes? It's not just harmless. We kind of talked about that. It contains nicotine, ultrafine particles, flavorings, such as diacetyl, which is a chemical that has been linked to lung disease, volatile organic compounds, cancer-causing chemicals, and heavy metals. So it's not always safer than cigarettes. They are inhaling some not good things. Here's what teens think they are inhaling when they use a vape. 66% think they're just flavoring, and that's it. 5.8 say marijuana, 13.2 nicotine, 13.7 don't know. So a lot of times they will say it is just flavoring, but it's really all that other stuff I said. Vapes do market flavors. They say it's for adults, but teens get hooked on that stuff. They talk about how the flavors are a primary reason they keep using. 84.9% say they use the flavors. So those are some examples of the flavors: fruit, candy, desserts, mint, menthol. So, yeah, so inhalants, we don't have like a ton of kids, I don't think, that use inhalants, but it is something we do deal with, because it's an easy find for some of our kids who are very impulsive. They call it gluey, huff, whippets, laughing gas, snappers, poppers, rush, bold. So basically it's gases or fumes from everyday products that can be inhaled or sniffed to cause an immediate high. It cuts off your oxygen, and so that kind of provides the high. Looks like someone who's very clumsy and checked out. It can harm eyesight, and some damage in the brain can be permanent. So because it cuts off that oxygen, you become clumsy. It can mess with your heartbeat because of the oxygen being starved. Your heart can even stop. It can cause nausea and vomiting. Over time, it can lead to loss of hearing, and really any kind of organ issues. One scary thing is it can cause sudden death. Anytime you're messing with lack of oxygen, that can be the case. Using inhalants from a paper bag or in a closed area, which does happen, does increase the chance for suffocation and death. So, yeah, I've known some foster kids who do that because they live like on a farm and there's a lot of farm chemicals or things like that. Typically, they're just trauma kids who are looking for, a quick high. So they could look drunk, dizzy, dazed, a strange breath odor, chemical smell, paint stains, red eyes, runny nose, slurred speech. So, yeah, if you would suspect that, that would be something where you would kind of try to figure out what chemicals would cause that and just be really cautious about having those in your home. So opioids are prescription medication. We do have kids who do these kind of things. Whether they get these, I mean, I know in our foster homes, our prescription drugs are locked up, but again, there's always that kid at school or a friend's house. There's different names for it. Sometimes the drug name, sometimes something different. But a lot of times they find these drugs when they're not prescribed them, because they just don't prescribe them a ton anymore. Maybe in smaller towns, but even when they're prescribed medically, opioids can be addictive. So even if someone is prescribed one of these medications, hydrocodone, oxycodone, morphine, Percocet, Vicodin, some of the names, misuse of these substances is rampant. So opioids affect our nervous system really, and our pain signals. And so that's kind of why it causes the euphoria or the high. A lot of times they create kind of a numbness because of that pain signal. And so our kids who have had a lot of trauma really kind of chase that feeling because they're feeling a lot of things that they don't want to feel. So there's a lot of self-medicating. So they slow down the actions of the body, like the breathing, the heartbeat. So the big concern with opioids is overdose, stopping breathing. They're super addictive. Um, Heroin is an opioid, but really, our kids are really doing a lot more of the prescriptions. Um, but people who do heroin and those kind of drugs typically start with something like prescription meds first. And then we know that they can kill you. Drug overdose was the leading cause of accidental death, with almost 70,000 overdoses between 2017 and, okay, in a year, a span in 2017. And over half of those were opioids. So, here are some side effects: just constipation, nausea, vomiting, sleepiness, dizziness, confusion, itching, and sweating. Um, Again, we kind of talked about what you would see if someone was using, and you're going to see the same thing. Peer group changing, maybe school performance changing, lack of interest, eating and sleeping habits, those kind of things. So I do want to mention fentanyl really quick, because the problem with fentanyl is that a lot of our kids who are using prescription medications are getting them from friends. And sometimes those prescription meds are not doctor's meds. They're meds that are made on the street, and they can have fentanyl in them. So fentanyl is it's a pain med. It's used to put people to sleep before surgeries. And so there is intentional use for fentanyl, but a lot of times people can be exposed to fentanyl without knowing. Illegal labs can make fentanyl really cheap, and it goes further in terms of getting people high. And so they mix it with other drugs to boost the potency and make more money. And so, in terms of our kids knowing what fentanyl is, 40% have heard of it and know what it is. So that's actually really good. Our campaigns are helping. But almost 40% haven't heard of it. So our awareness is increasing as they get older, which is good, because it is very deadly. 6 out of every 10 fake pills with fentanyl have enough to be deadly. So it's terrifying in a way. I have, nieces and nephews who are very young, but to think of them being able to go to a party or something and someone offers a pill, and that pill could kill them the first time they use it, is terrifying. So our kids need to be made aware of this high risk drug use. So a lot of fake pills are made to look like the actual painkillers, but they're not. They're not Oxycontin, they're not Percocet, they're not Vicodin, they're not Xanax, they're not Adderall. They're just made to look like that, and they have got some level of fentanyl in them. So really, we just need to talk to our kids and educate them about that very high risk of taking something that could kill them. So, I just have a little bit on hallucinogens. I don't feel like we have a lot of kids who use this, but we do have some kids who will use any drug because of their trauma and their impulse control. I don't know that it would be easy to get, those in Kansas, but people can find things: LSD, mushrooms, peyote, PCP, any kind of drug that alters a person's awareness of surroundings and thoughts can be dangerous, especially with kids who have mental health issues. They can affect the brain long term. They affect serotonin, which is really what helps with our sleep, muscle control, and especially with our mood. And so it can cause lasting consequences like psychosis or mental disorders. And then it can be unpredictable. So if someone can take something, it may last 20 minutes or it may last all day. And so that's something to be aware of. And then they can also be addictive. I think, again, it's more like the marijuana. It's psychologically addictive. And then if you don't take it, you become anxious because you really like the feeling of taking it. So, yeah, you're just gonna see some weird stuff, probably kind of like the inhalants, the nausea, vomiting, some of the mixed senses, excessive sweating, a lot of paranoia, some weight loss, anxiety, maybe even some psychosis and hallucinations, social withdrawal. Probably their friend groups might be different. I think our kids are more aware of um, their bodies and their body images, and so that's why I did include steroids. The statistics say that our kids aren't using very many, or not very many of our kids are using steroids. I think it's pretty low. Um, but I do think our kids are willing to use medications that make them skinnier or have more muscles because of social media. Um, and so these are, medications that help them build muscle. They can be hormone medications like testosterone. Um, and so essentially, most of the time it can be a shot. It can also be pills, but regardless, it's unsafe for them to be taking them. They can really have some significant side effects, especially because they're growing. And if they're taking any sort of hormones while they're growing, that can really mess with things. Steroids can really affect the heart. We have a lot of research on that because um, a lot of bodybuilders who were using steroids, decades ago have um, died from heart issues and things like that. So we know that that's something that can happen. Um, Steroids can really affect the mood, and these are kids who are already hormonal and have mood issues. And so that's something that we would probably see. And then if they are using needles, which is likely because of the hormones, that's how you would inject them, then you would be at risk for um, a lot of things, infections at the needle site, if someone had HIV, hepatitis, those kind of things. Um, yeah, you're just gonna see, I think you would maybe know some signs, someone's obsessed with their body image, but some of the side effects are like acne, jaundice, swelling, aching joints, bad breath, a lot of that mood swings, nervousness, body trembling. So I did include some trends on here, but it's really hard to find trends research wise. I think they don't put those on the internet because they don't want teens to find them, which is really good. Um, but it's hard for someone like me to stay ahead of it and let you guys know. But there has been trends of kids drinking alcohol from hand sanitizer, which has an incredible high alcohol content. Um, so watching out for that. Um, Something about smoking large quantities of nutmeg, which the spice does have something in it that can cause hallucinations. So that's not good. Cough syrup, which is why when you go to the store, they have to see your ID. But kids drinking large amounts of like Robitussin, it's called robotripping, which makes them almost hallucinate, really. Um, so that's something to watch out for. Okay, this one is a little out there, but vodka tampons, sometimes our kids will look for ways to ingest alcohol without drinking it. That way it's not on their breath. Um, but there are a lot of side effects that happen because of this. It's certainly not safe. Dust off is one of those household substances that they can use for huffing or inhaling. So that's been a trend. And then Whippets is whipped cream, which is it has nitrous oxide in it. So that's a different way for them to get high by using canned substances. So that one is not a good one. And then there are some other ways for them to be drinking at school. One of them is to soak like gummy bears in alcohol, and they will then bring the gummy bears to school in, in bags or something and eat them throughout the day. So they think that they're getting away with drinking at school. Teens are sneaky and they find ways to do things. So talking to teens about use, um, there's a couple things to maybe consider. If you suspect that your teen is using, it's really hard to have those conversations. They become defensive. They don't want to, talk. So finding a time and place when you're both comfortable, when the teen is not high or using, and when you're not going to be interrupted. Trying to find a time when you could set aside phones, when you're not angry or frustrated. So when things are calm, and then obviously when they're not intoxicated, that's not going to be a helpful time. So talking with our teens, actually having a conversation with them, instead of lecturing, kind of listening to what they say and then maybe providing them some of that information, can avoid some of that defensiveness and provide a back and forth conversation. Discussing reasons not to use drugs, and then kind of finding ways that that personally can affect things that are important to them. If they're into sports, that might be a time for you to say, yeah, that could really affect how you play football, even if you're on the team, those kind of things. Instead of just lecturing and saying, no one in my house uses drugs, because that has not been helpful or effective over time. Consider some of the media messages. Some of our kids have views because they've been given poor information. And that information has been from TV, movies, songs. And if they're given that poor information, there's no way they could make a appropriate decision. So kind of talking with them about what their views are before just straight out telling them that their views are wrong, because you have to kind of give them a better worldview. Giving them ways to resist peer pressure, because they probably will end up in a situation where something might happen. And so giving them ideas before that happens will help them to feel more confident in figuring something out. Because sometimes when we don't have a plan, we just kind of give in, especially with teens. And then be ready appropriately to discuss your own drug use, because they might ask you. And if you haven't thought about what you're going to say, it might be a little bit awkward. But if your teen says, I've seen you drink a beer or something before, you need to be able to say, well, if you're 21 and it's legal and you can be appropriate and it's something I enjoy once a week, that will go a lot further than saying it, it doesn't matter. It doesn't matter what I do. It only matters what you do. So being able to have those conversations. This is a little bit longer video, but I think we'll be about done after this video. It's just, yeah, we'll be about done. It's just so good. When it talks about why our childhood trauma, I think it's like less than 10 minutes. It talks about why our childhood trauma leads to addiction. And I think it's just, so he just explains it so well. This is Gabor Mate, and he has a really good understanding of childhood trauma, and he's written several books. But yeah, this is good.
So an addiction is a complex psychological, physiological process, but which manifests in any behavior that a person enjoys, finds relief in, and therefore craves in the short term, but suffers negative consequences in the long term and doesn't give up despite the negative consequences. So craving pleasure, relief in the short term, negative consequences in the long term, inability to give it up. Now, notice I have said nothing about substances. I said any behavior. So it could be related to cocaine, crystal meth, heroin, fentanyl, marijuana, nicotine, alcohol, whatever. Could also be sex, gambling, internet, relationships, shopping, eating, work, extreme sports, working out, pornography, any number of human activities. So I said any behavior. Now, the official definition of addiction, according to the American Society for Addiction Medicine, is that this is it's a primary brain disorder. It arises in the brain, well, largely due to genetic reasons. This is how they see it. And I say that's just not true. The other popular idea about addiction is that it's a choice that somebody makes, that people choose to be addicted, which is what the legal system is based on. Because if people are not choosing, what are we punishing them for? And although I think the medical definition is closer to the truth, I don't see it as it's a genetic disorder, and I don't see it as a primary brain disorder. So let me perhaps show you why, if that's okay. A human being has two fundamental needs, apart from the physical needs, in infancy, in childhood. One is for attachment. Now, attachment is the closeness and proximity with another human being for the sake of being looked after, or for the sake of looking after the other. Now, human beings, as mammals, and even birds, are creatures of attachment. We have to connect and attach because otherwise we don't survive. If there's nobody that's motivated to take care of us, to attach to us that way, and we're not motivated to attach to others, we just can't survive. One interesting thing is that the endorphins, which are the body's internal opiate chemicals, which heroin and all the other opiates resemble, they help to facilitate attachment. So if you take infant mice and you knock out their endorphin receptors so they don't have endorphin opiate activity in their brain, they won't cry for help and separate from their mothers, which would mean that they would die in the wild. And which goes back to what happens early in childhood when there's stress and trauma, these endorphin systems don't develop. And then when people do heroin, it feels like a warm, soft hug to them. They feel love and connection for the first time. That's why it's so powerful. But so we have this need for attachment, without which obviously the human infant, who's the most helpless, the most dependent, the least mature of any creature in the universe at birth, cannot survive without the attachment. And that attachment relationship, given that we have the longest period of development of any creature, well into adolescence and beyond, attachment is not a negotiable need. But we have another need, which is authenticity. Now, authenticity, auto the self, means being connected to ourselves, just knowing what we feel and being able to act on it. So that means our gut feelings. So let's look at how human beings evolved. For hundreds of thousands of years, and for 100,000 years or so of this species existing on Earth, how did we live? We didn't live in cities and houses and so on. We lived out there in the wild until very recently in human existence. Now, just how long do you survive in the wild if you're not connected to your gut feelings? Not very long. If you start using your intellect instead of your gut feelings, you just don't survive. So that's a powerful survival need as well. So attachment is a survival need, authenticity is a survival need. But what happens if your authenticity threatens your attachment relationships? For example, as a 2-year-old, you get angry because you didn't get that cookie before dinner. But your parents can't handle anger because they grew up in homes when there was rageaholism and they're terrified at the very expression of anger. So they give you the message that good little kids don't get angry. The message you receive is not that good little kids don't get angry, but that angry little kids don't get loved. Because your parents are now sullen, they won't look at you, they talk to you in a harsh way, you're not getting loved. Not experiencing love at that moment. Now, but you gotta stay attached. Guess what you're gonna suppress? The authenticity every time. And this is how we lose connection to ourselves and to our gut feelings. So that, strangely enough, that very dynamic, which is essential for human survival in a natural setting, not becomes a threat to our survival in this more modern setting, where to stay authentic is to threaten attachment. And so we give up our authenticity, and then we wonder who the hell we are, and whose life is this, and who's experiencing all this, and this life doesn't, and who am I really? And so that's where the reconnection has to happen. That's where the healing happens, is with that reconnection. But it's because of that conflict, the tragic conflict in childhood between authenticity and attachment that most of us face, that we lose ourselves and lose connection to our gut feelings. Now, this leads to the question of trauma, because it's one thing to recognize that all this originates in childhood pain. It's quite another to transform that pain. And for that, we have to understand what trauma is. So people often think that trauma is what happens to you. So trauma is a divorce when you were small and your parents fighting. Trauma is your mother's depression. Trauma is your father's alcoholism. Trauma is your parents' argumentation. Trauma is physical or sexual abuse or some loss. Those aren't the traumas. Those are traumatic. But the trauma is not what happens to you. The trauma is what happens inside you. And as a result of these traumatic events, what happens inside you is you get disconnected from your emotions, and you disconnected from your body, and you have difficulty being in the present moment, and you develop a negative view of your world, and a negative view of yourself, and a defensive view of other people. And these perspectives keep showing up in your life in the present. So in other words, the addiction is not the primary problem. It's an attempt to solve a problem. And then the real question is, how did the problem arise? In other words, this is where my theory is, that it's always rooted in childhood trauma, and that the addiction is an attempt to deal with the effects of childhood trauma, which it does temporarily, while it creates even more problems in the long term. And so the issue is not just to recognize what happened 10, 15, 30, however many years ago, but to actually recognize the manifestations in the present moment and to transcend them. And how do you do that? By reconnecting with yourself, by restoring the connection with your body primarily and with your emotions that you lost. And once you do, when you found these things again, then you have what we call recovery. Because what does it mean to recover something? It means to find it again. So what is it that people find when they recover? They find themselves. And the loss of self is the essence of trauma. So the real purpose of addiction treatment, mental health treatment, any kind of healing is reconnection.
Yeah, so he's a really good resource on that, on addiction and that kind of thing. So I'm just going to talk about treatment, and then we'll be done here. But excuse me. So here's some treatments that we can offer. Outpatient, intensive outpatient is probably the most common that we can offer. It's pretty effective, and it's usually recommended with less severe addictions, because it's the teen lives in home and then just goes to a place daily or several days a week to kind of learn about coping skills and how to and have support for how to kind of lessen the addiction and stop using. So if they have a very severe addiction and a lot of mental health issues, this isn't the way to go. A partial residential is for a higher level, and usually this is every day. So maybe 4 to 6 hours a day, 5 days a week, but they're still living in their home. And then the most intense is the residential inpatient treatment. And this is where they need to be managed in a hospital, 24-hour day structured environment. And residential can be from a month to even a year. I will say it can be difficult to find these treatments for teens, especially, anywhere really. I was going to say larger places, but I'm sure in small towns as well, because they may not have access, just because there's probably not enough spaces for teens right now. So there's a lot of different ways we can address it. Behavioral approaches, a lot of times family based is kind of the way they want to go, to get the whole family involved, whether that's probably more likely the foster family, but the bio family as well. There is addiction medications, but that's really tricky because I think there's a lot of laws and legislation regarding if we can prescribe like even nicotine patches, beyond that, opiates and those kind of things for teens. So whether that's allowed or not in different states is I'm not sure. And then recovery support services like groups for teens who are sober and intend to stay sober. Some of the behavioral approaches just fall back on basic cognitive behavioral therapy, looking at their thoughts, emotions, feelings, some motivational enhancement therapy, even 12-step. All of these things are very helpful. Family-based, like I talked about, kind of getting the whole family on board with helping support that abstinence and even giving some information regarding substance abuse. And then, like I was talking about, the addiction medications. So it says the only FDA approved medication is buprenorphine, which is approved for 16 to 65-year-olds. I don't know if that's approved in this state, but it can help lessen some of those cravings and withdrawals in some disorders. And then the ongoing groups, the recovery groups, peer support. There are recovery high schools. I don't know of any, but I know that is something that happens. So there are several resources here that have to do with 12-step and those kind of things, if you're interested. And then here's some of the references I used. So that is kind of the whole thing. Is there any questions?